The severity of a baby's torticollis is important to determine the proper course of treatment. My name is Timothy Rosner, Doctor of Physical Therapy, and welcome to Tummy Time Academy. The information I'm going to be providing you in this video is summarized from the 2018 Clinical Practice Guidelines for Congenital Muscular Torticollis from the American Physical Therapy Association. Congenital muscular torticollis is an abnormal posture of the neck, typically characterized by a head tilted to one side and turned to the opposite side. This is often due to a shortened or thickened neck muscle called the sternocleidomastoid. Now, torticollis is quite common with an incidence rate of around 4 to 16% of births. It is seen more frequently in taller newborns and breech presentations. It can also be accompanied by an abnormal flat spot on the head, hip problems, arm and shoulder problems, feeding difficulties, as well as developmental delays. So we're going to be talking about 3 types of torticollis. The first one's postural, second one's muscular, and third one is fibrotic mass. Now, in an effort to avoid using as much scientific jargon, how about we just call it the thickened torticollis? The first type, postural torticollis, is the mildest form where the baby has full motion when turning their head, meaning baby can turn their head about 90 degrees, and full flexibility. However, it has a lingering problem where they have a preference to turn their head one way and to tilt the other way. The second type, muscular torticollis, is the more moderate form where there is actually a decreased motion and decreased flexibility when the baby is trying to turn their head. We will want to measure how much the restriction there is by using a goniometer and can further categorize this muscular torticollis into the following: less than 15 degrees of restriction, 15 to 30 degrees of restriction, or greater than 30 degrees of restriction. And the third type, a thickened torticollis, is the most severe form where there is a fibrotic mass in the neck throughout the sternocleidomastoid muscle. This is, of course, would be accompanied with decreased motion and decreased flexibility. And so when determining what course of treatment is most appropriate for a baby with torticollis, it's important to determine the severity. And we're going to use 2 things. The first one, the baby's age, and the second one, the type of torticollis. This graph is straight from the 2018 Clinical Practice Guidelines. Using the baby's age, we're going to separate into the corresponding group. 0 to 6 months, we will call the early group. 7 to 12 months, we will call the late group, and greater than 12 months, we will call the very late group. Next is to determine what type of torticollis does the baby have. Is it postural, where there is no restrictions to motion or flexibility, but has a lingering preference to turn their head one way? Or is it muscular, where motion and flexibility is restricted, and by how much? Again, is it less than 15 degrees? Is it 15 to 30 degrees? Or is it greater than 30 degrees? Or is it a thickened torticollis? Using age and type of torticollis, follow the graph and arrive at the corresponding severity. For example, let's say we have a 2-month-old with full motion and flexibility, but tends to turn her head towards the right more frequently. We use the early group graph, follow the line to postural, and follow the line to a grade 1 or early mild torticollis. If she had a muscular torticollis with a restriction of less than 15 degrees, this would also be classified as a grade 1 torticollis. A restriction of 15 to 30 degrees is a grade 2 or early moderate torticollis, and either a restriction of greater than 30 degrees or a thickened torticollis would be considered a grade 3 or early severe torticollis. For babies between the ages of 7 to 12 months, you would again determine the type of torticollis, how much is the restriction, and follow the graph to the corresponding grade. Grade 4 is called later mild, grade 5 is later moderate, grade 6 is later severe, and grade 7 is later extreme. For kiddos older than 12 months, you'd use the graph for the very late group. Now, due to the later age, no matter the type of torticollis, they will be receiving the severity of grade 8 or very late. Now that we have determined the appropriate severity of our baby's torticollis, we can make an appropriate plan of care, and this may include something like parent education, active neck stretches, passive neck stretches, play to promote symmetry, or even adapting the room or baby's environment to encourage them to look in the non-preferred direction. I will be making a separate video on specific exercises to treat torticollis, so make sure to hit that subscribe button and not miss it. After a month or so of treatment, it is important to reassess and measure how much progress has been made to then determine if frequency or intensity of exercises and activities need to be increased or decreased. For cases that are not showing any progress whatsoever in several months of therapy, a discussion may be warranted between the family and the medical team about therapies that are not as conservative as physical therapy. An example of this would be a Botox injection. Yes, Botox, that stuff that celebrities use to anti-wrinkle their face. In this case, it would be used to decrease the activity of sternocleidomastoid, so then we're able to stretch it more effectively. Or perhaps the medical team decides that the torticollis is so severe that they recommend going in and surgically lengthening the sternocleidomastoid to regain full motion. Of course, we would reinitiate physical therapy after surgery once cleared by the surgical team. And so there you have it. I think a key takeaway from this video is that time is important. The longer time has passed since noticing a child's torticollis, the more severe the case becomes, and thus the more invasive therapy becomes. If you have any suspicions that your child has asymmetry in their neck, then I encourage you to discuss this with your pediatrician instead of the old wait and see approach. To further illustrate how important it is to initiate therapy as early as possible, 98% of babies who started therapy before they were 1 month old, within 1.5 months, they had full motion of their neck. Now, after 1 month of age, this therapy length of time increased to 6 months. And after 6 months of age, this length of time increased to 9 to 10 months, with less babies achieving full motion in their neck. So again, if you are a parent whose child potentially has torticollis, then I encourage you to seek assistance from a professional, as time really does matter in this case. And when you're waiting for these appointments, I encourage you to continue tummy time for your newborn or baby, or increase tummy time to improve their neck strength and arm strength. If you or your newborn is having difficulty with tummy time, then I encourage you to watch my video right up here, the complete guide to tummy time for your newborn. Otherwise, I hope you learned at least one thing from my video, and I will see you in the next one.